Well, thank you for having me. And like Daniel just said, I am with the School of Public Health at the University of Michigan, and I do global health research. Actually, I do environmental health research, but I do have a passion for infectious disease. And so that's probably why I'm here today. In the last 6 months, I have predicted the fact that we would be suffering an Ebola outbreak in the US. Well, maybe it's not an outbreak, but I did think that it wasn't impossible that we would see Ebola in the US. And I've written about this, I've spoken about this in various fora, done a TED Talk, done, of course, being on stage and things like that. And most recently, I did have something on the Huffington Post about the challenge of quarantine, which has become an issue even here in the US. So today, what am I talking about? Well, it's Ebola, global health, and the role of technology. And I think there is something that technology could do. These are the facts. Infectious diseases do not respect international boundaries. Let me say that again. Infectious diseases do not respect international boundaries. By the mere fact that they spread from person to person, it means no one is safe. I mean, not in these days of high-speed travel, cheaper air travel. Anybody could be anywhere in the next 24 hours within the globe. And if he has an infection, then there's a risk to whoever is around him. And so I say it again, infectious diseases do not respect international boundaries. This is important, particularly with the issue of Ebola. So how come I am the one talking to you about infectious diseases and our response to epidemics? I think the reason is this. Many people might not recognize what that is, but that is Africa's meningitis belt. Now, in that zone, every year, we have thousands of people suffering meningitis. Meningitis, as we know, is a bacterial disease that in that zone occurs as an epidemic. And I was one of those people who suffered. How does this link to technology? Reason is this: I died. I literally died from meningitis when I went into a coma after 2 weeks or thereabouts of having headaches and fevers. And this was just at the beginning of medical school for me. I died. But thanks to technology, I came back to life. And without technology, I definitely wouldn't be standing here today. But the technology that saved my life was not any of what we've talked about today. It was completely low-tech. That is what we still see in Nigerian hospitals. And that was the kind of hospital I was in. Places where diagnosis relied very heavily on clinical signs and symptoms. Places where, in my case, there was no PCR for what bacteria it was, what virus could it have been. There was no CT scan done to say, oh, was this a stroke? Was this bleeding in the brain? Why was I in coma? There was no such thing. There was no high-tech gadgetry in an ICU. I was not in an ICU. Which sounds, horrendous. How do you treat someone in a coma without putting him in an ICU? Well, ICUs virtually do not exist where I come from. And in the hospital where I worked, the ICU chief would tell you, don't bring that patient here. We may be an ICU, but we do not function as an ICU. So treat the patient where you can, and let's see how it goes. As I said, meningitis is a reality in West Africa. And it's probably even more important that I'm speaking to you right now, because the next epidemic is going to start this month. Sometimes it looks like I've been a prophet for a while now. And that's because I'm just saying what is obvious. Epidemics of meningitis occur in West Africa every year in the dry season. The dry season starts from about November, runs till about May. Keep your eyes open, keep your ears open, you will hear. But just this year, there's been 23,000 cases, even more, with more than 1,400 deaths. This is according to UNICEF as at March of this year, while the 2014 epidemic season was still going on. Now, obviously I survived meningitis and I'm here, thanks to technology. But the fact that I survived meningitis in those conditions is instructive for us today as we tackle Ebola as a global health challenge. the hope we have right now is that the technology we have available to tackle this outbreak isn't low-tech. We've been talking about real high-tech stuff. And not just that, the people to deploy them are here, right here. So what exactly do we need to do? Now, to be clear, tackling any disease outbreak isn't just about the disease. It's about the disease and the determinants of those diseases, the cultural factors, environmental factors, political factors that come into play. And of course, if you don't tackle those surrounding determinants, you would hardly ever take care of an outbreak. Now, Ebola. I would not waste your time so much in talking about Ebola. We've heard this so much. The media has done a good job in creating awareness. And the thin line between awareness and caution, awareness and fear, is something that is hard to deal with. So people think the media have created fear. I think they've created more of awareness than fear. And that awareness is useful. Everybody knows Ebola causes fever. Everybody knows Ebola, causes headaches. You have things like diarrhea, vomiting, and maybe you may have internal bleedings, external bleedings, and things like that. We know all that. We know that Ebola can be contracted by basically being around someone who has Ebola. You could get it from objects that have been contaminated with Ebola, probably by animals that have Ebola in them. We know that. But it's important that we talk about this because the things that we can do for this outbreak and for every other outbreak will depend on what we know about the disease. We also know that Ebola can be diagnosed, with technological facilities. In the case of Ebola, it's not that easy because the symptoms are very much like a flu, very much like malaria, could be typhoid fever. So how do we know it's Ebola? Well, we do serological tests, we do genomic assays, we do cultures, viral cultures, electron microscopy, and things like that. And when I say we do, I mean we on this side of the world, where I am right now, do all that. In Nigeria, that's not the case. Treatment for Ebola, as we know, doesn't have drugs, no vaccines. So what exactly do we do? Well, we'll keep people alive, basically. Keep them alive, give them fluids, be sure they don't have other infections, treat those kind of things. And importantly, we engage the community. Things like contact tracing, things like surveillance, and basically dealing with those cultural issues that make this outbreak continue. An example is people that by that culture would go grab the dead body, and do things around the dead body because that's how they bury people. I mean, those are things that are important in the transmission of Ebola. Those are things we need to deal with. So what can we do as far as technology is concerned with Ebola? And please do not forget that this is not just about Ebola. In fact, this talk, my standing here, is not about Ebola. It's not about what's happening now, because I believe we will get through this. But what is the next big thing coming forward? What is the next big thing as we go ahead into the future? Are there no other Ebola-like viruses? Of course there are. There's Marburg, there's Sinombre, there's 1,001 emerging infectious diseases. And so what we talk about today isn't just about Ebola, but I'm trying to challenge your mind, rather, to the possibilities of what we can do today and move into the future. Now, one of the most important things in public health is good old contact tracing, good old surveillance, good old simple methods you can use to protect yourself and protect other people, surveillance being one of the most important ones. And I have been a strong advocate for screening at international airports, for one. Now, do we have kits that could rapidly screen an individual that comes into the airport with symptoms that look like Ebola? Do we have kits that could do this test and within 5 minutes you have a result? Maybe less. Maybe we do have those kits. But I think the quickest I know of is about 12 minutes. Imagine 100 people boarding a plane and you have to do a test for 12 minutes each person. That's talking about 120 minutes delay just because we want to deal with this thing and not allow it cross to other borders. And so we need quicker kits. There must be better ways to do it, and that's why I'm talking with you today. Let's work on those. In the Ebola treatment units in West Africa, it would be a good idea to have kits that could deal with the disease, make the diagnosis, but also tell you about the general status of people's health. How about their liver functions? How about their kidney functions? How about their electrolyte status? Do we need to do something about those? In one shot, you get those results. Can we do that? Should we do that? Yes, we should. Can we do that? I think we can. And I'm trying to direct your efforts towards those. Look at this. What do we see? Folks dressed up in hazmat suits. I don't know anybody here, if anybody has worn a hazmat suit before, but I have. And I told you, like in the beginning, I've done environmental health research, and I've had to wear many of these things. In the level B suits, like they are wearing, where you have everything covered except that you don't have respiratory isolation, you don't wear those things for 15 minutes, not even in winter. 0 degrees Celsius, 30 degrees Fahrenheit, you can't wear this thing for 15 minutes and do any reasonable work. But folks are supposed to wear these things out in West Africa at 100 degrees Fahrenheit. It's not possible to expect that people are going to keep to protocol as long as they are uncomfortable. And therefore, I think that technology has a role to play in this. Can we make comfortable protective suits? Suits that breathe and yet protect you. How about contact tracing? Can we use smartphones or even smaller technologies like our regular mobile phones, the kind of things they have in West Africa, or things that don't even depend on the network, to help people key in their concerns about Ebola? I mean, someone thinks, oh, I may have a fever. Someone thinks, oh, maybe my brother has a fever, and this may be Ebola. Or something else. Keys in his data, sends it up on the cloud, we get the information, and we give feedback as to what you should do. All right, there is an Ebola treatment unit open. Some of them are never are, as people are always, there's always too many people in those places, and some people don't just want to go. Maybe there is none open, the nearest is nearby, this is what you should do now, this is what you should do tomorrow. Could we do those kind of feedbacks, using technology? What do we see here? Well, this is quarantine. I pray it never gets to the point where we have to quarantine people in communities in the US or in anywhere else. But the issues with quarantine are just gargantuan, they're just too big. Just last week, people had to break out of quarantine because they were hungry. Does technology have a role? I think so. You can't keep people in places like this and expect them to stay weeks without food, without supplying the food. And that's where technology comes in, helping us to coordinate the things so that people can actually stay where they are, you can get them the food they need, you can coordinate the warehouses. Most times, the food that they need is actually in a warehouse somewhere nearby, but they don't get it. And people break out of quarantine and then spread the disease even everywhere else. Networking. Would you believe that in a place like Sierra Leone, Liberia, and Guinea, there are no network of health facilities, no network of agencies that actually work on these things, no network across borders, and yet these are issues that affect the entire West Africa and the world. And yet the agencies working on these things do not know exactly what the next person is doing. People may be putting their energies into one thing, the other person is putting the same energy into the same thing, and yet the things that need to be done are not done because we don't have information sharing. Can technologies do something? Information technology could help us here. But the issue is this. Ebola will not go away, and even if it does, something else will come on as long as we have determinants that underlie the issues of infectious disease, one of them being literacy, education. Is there a way technology could help educate the masses? Is there a way we could bring people out of poverty such that they do not hold on to ideas that do not seem progressive? Is there a way we could get people out of poverty through technologies by making simple devices that can help them build their economic lives? We might not understand how it is that people should get out of poverty, but when you think that people who are poor do not care for education, people who are not educated do not care for the real essence of religion, and such people will become extremists, then you hear of things like Boko Haram or things like ISIS. Things that are, in your mind, if you think if this guy had enough food, why would he want to join something like that? Poverty underlies many of what we are dealing with. And until we get people out of poverty, we will still continue dealing with this. Not just in West Africa, but in the world. Do we have anything to make governments accountable? Particularly governments in West Africa. Governments who are corrupt. Is there a way we could use technology to channel efforts, crowdsourcing ideas, crowdsourcing information that could actually be put forward to policymakers somewhere like, these guys are not just getting this thing done. Maybe we shouldn't be supporting them. Can we get technology to make elections truly free and fair? Is there a way we can harness technology to deal with the issues that surround Ebola and every infectious disease and the global health issues that we have? Well, I think we should, and I think we can, and I think the people are here. Everything I've said today is not just about Ebola. It's about global health. It's about the health of you and the next person, and the guy who is 1,000 miles away. Until we begin to do these things right, the determinants of infectious disease anywhere in the world will continue. Technology can help us get this thing right, and I think the time is right. Thank you. Thank you. All right?